My name is Kevin Skina. I'm a social worker at the Seattle VA in the Addiction Treatment Center. I'm on the co-occurring recovery team, and I've been here for about 4 years. Harm reduction is the goal of reducing the harms associated with use. So use is not necessarily healthy for the body or the mind, and somebody may have an interest in cutting down or reducing or using at the same level, but just in a way that's more safe. And that's what harm reduction is. Is there a way that we can support somebody in working towards that? The goal is that everybody, whether they have a substance use disorder or not, is just hopefully working towards improving their own well-being. And so a harm reduction program is trying to support somebody in doing that. And it doesn't assume a one-size-fits-all, that a person gets to decide for themselves, what is my goal? And that we would encourage them to find the areas of their lives that they feel like maybe there's something that's missing that could help support them in keeping to those goals. We help them in developing skills to maintain use within those goals. And if a person has a slip or uses above those goals, we encourage them to be curious about that. What was going on in that moment? And if that moment is likely to happen again, is there something that the person might have done differently so that they could be more successful according to their own criteria the next time? With alcohol, if somebody's trying to reduce the harms associated with drinking, they may try to start later in the day. They notice they drink more if they start around 4 or 5, so instead they try to start drinking maybe around 7, closer to bedtime. They may alternate alcoholic drinks with non-alcoholic drinks. So they'll have a beer, and then instead of going to another beer, they'll have water or soda instead. With IV drug use, needle exchanges, so that you're not reusing the same needle because the needle tip will blunt and can damage the veins. Not sharing needles because there's a risk of infection associated with that. Test strips, fentanyl test strips, to see if there's a risk that fentanyl could be in your supply. And for us, the things that we're mindful of, like, have you tried this before? What are the potential risks? What's the current state of your mental health and your physical health? Are there other things that you're wanting to work on with respect to your mental health, and substance use is making it difficult, even though it's moderated? Sometimes there's an assessment I'll do with somebody. There's some research around how they score on certain moderation tools, and depending on where they score, I can say statistically, somebody who is in similar circumstances to you, this is how likely they are to be successful in moderating. And of course, this is not predictive. It's just something that's sort of a population sample, but for some people, it's sort of food for thought. So where moderation might not work for somebody, one is if, like, the health impacts are just very severe. Like if somebody already has assessment around fatty liver or cirrhosis, and they're saying that they have a moderation goal, there are some pretty serious health risks if they continue to drink. Another part of this conversation may be, have they tried moderation before? How did it go? Are the circumstances in their life different now so that they're likely to be more successful? You know, somewhere down the road, they may decide, I don't need to drink anymore, or they may feel like their drinking is in a much more controlled and stable state, and that's success. That somebody accomplished what they wanted to accomplish when they came to our clinic.